everyone. I'm Laser Basi, who's a Carcinos Cancer Care in Faldani. Today we speak about a word that quietly frightens every family, cancer. For years in our state, hearing that word meant something else too. Packing a bag and traveling far, maybe Guwahati, Kolkata, Vellore, Mumbai, Delhi, often for months and often at a cost that burdened families. Akoina cancer haiba wahise tabu matamda yamna akitu jungba phawba family gi singi damakti yamna nungaitaba aduna imungda cancer nare haibase yawbo taragadi Manipur gi mapanda kari lamda chatkadori bano Vellore da chatkadra Kolkata chatkadra Guwahati Mumbai Delhi da chatkadra karamba doctor da tanagani karamaina layengani aduga magi sales yam tingna mapana chalaga layengani haibagi adukumba yamna mi paiba adukuma wahini cancer haibasi adubu masi adum ahongba matam gi matungina ahongba lakle this is beginning to change aduna ngasi mag Imphal gi mayol da leiriba Carcinos Cancer Hospital da koi expert doctors mayam ma leire cancer lying lying pathap chatha duna cancer nariba miabu moibu cancer patients in the care piduna moibu lying pathap chatha duna moi punsi yam nungai na treatment piduna minor treatment lying pathap chatha duna leiri aduna today we have doctors specialist doctors caring for cancer patients right here in Imphal at Carcinos Cancer Hospital. Let me take the opportunity to introduce them. First, we have Dr. Thangjam Nirpendra, a consultant radiation oncologist with over a decade of experience in oncology care, radiation therapy, and cancer management. Holding an MD in radiotherapy, he has served in key clinical and public health roles, contributing significantly to the delivery of cancer care in Manipur. Welcome, Doctor.
Thank you.
We also have with us Dr. Pallavi Mehta, a senior consultant in clinical hematology with expertise in bone marrow transplantation, CAR T-cell therapy, and advanced cellular therapies. A DM in clinical hematology from Christian Medical College, CMC Vellore, and having practiced at Rajiv Gandhi Cancer Institute, Fortis Memorial Research Institute, Narayana Multi-Specialty Hospital, and Max Hospital. Dr. Pallavi specializes in the management of blood cancers as well as complex non-malignant blood disorders. Welcome, Doctor. Mathangda, we have Dr. Thingujam James, a consultant gynecology oncologist with specialist expertise in the surgical management of women's cancers, including ovarian, cervical, and uterine malignancies. He holds a fellowship in gynecological oncology through the Association of Gynecological Oncologists of India. Dr. Bursutaram Nokchari. And last but not least, we have with us Dr. Konzam Jeena Devi, a consultant anesthesiologist and critical care physician with over a decade of experience in intensive care medicine, anesthesia, and perioperative care. Holding an MD in anesthesiology and advanced training in critical care PDCC, she has been instrumental in managing complex and critically ill patients across tertiary healthcare settings. Dr. Vasutaram Nokchari. So we have all the experts, doctors from Carcinos Cancer Care Hospital with us today. We'll be discussing about what is cancer, and we'll be busting some myths about cancer, as well as we'll be talking about treatment facility available for cancer patients in Manipur, here in Manipur itself. To begin with, let me come to Dr. Thangjam Nirpendra. Doctor, akoina cancer haibasi taw matamda yamna kiba aduga magi lying pathapse kamain chathagani Manipur gi mapana chatpa taragani sel tingba karma doctor da approach tawgani haibe gi sukumba yamna worry myam lay. So but cancer is the same disease everywhere, whether it's in Manipur or in other parts of the country or the world. Aduna, why Manipur needs its own answer to cancer?
Thagachari. Question si akogi cancer gi harap matamdadi cancer gi scenario si Manipur ga athopa India ga te passing si ge yengba matamda kadang khena bakra lek akogi Manipur si picture agasu cancer gi incidence prevalence sidadi yamna wangna leiba mafam ama oi India gi not only India akoi India khatang na tabida Prithvi ko ne yang matam da globally if you look into it north east se akoi na cancer hub haina khangna re
India gi oina
all over the world yang ko matam da ko ne kan India gi oina so the Prithvi gi cancer scenario si yang matam da north east is the cancer makal khara lei which is like quite gi yamna phangba mafum khara akoi north east su lei re ba advain tawdana Manipur sisu cancer north east ki part ma ojaraga so cancer ki incidence is the masing akal se amna wang lay not khoi India gi yang matam da South India khoi southern side is the cancer makal khara lay adudana yamna rare oina leiraga khoi northeastern India is the especially Manipur Nagaland side is the yamna hana common oiba samna da khoi naton gi maning thangba jaga da leiriba nasopharynx ke hariba si khoi yamna khoi Manipur state yamna magi kano se cancer gi chang si ang bol adudagi akoina amuk akogi chariba chinjak andagi hoskin naha singchina tobacco season na hidak mana season na ba churup season na pa khaini andagi akogi asai talab kai season na mayam singchina siga mari dainana akogi siga thokpa ya ba cancer makal khara haigadi oral cancer ko lai cancer khanau gi manungi cancer andagi akogi food pipe ki cancer gastrointestinal tract chakhau gi colon sugumba mayam si akogi Manipur state yam chang yang wang ndigi nupi rom da haraga su akoi angang khau machingi cancer cervical cancer breast cancer moi si chang yang wang kano to bu stage da ta ya yang no matam da su ko aduga hujik akoi gi demographic profile da natraga akoi gi patient sing sigi socio-economic condition da yang uraga di Manipur si yam sothana leiba patient sagi lam da yam sothana leiba mapam ma oibani aduna akoina anabasina cancer ama nare haina diagnose tawpa matamda moigi wakal sida leidosi thaina dagi hana mitrama haza wakal da ma leije cancer bu naraga di akoi si layang bang amaroi paisa yam changba laina amani aduna akoi si layang na bu hana bada yum calls mai tumna noi manga dori ni hana wakal sugumba mayam su lainai si leitaba nate matam khargi mamang da sahi khargi mamang da di akoi cancer si nare ha matam mapan da chatlaga Delhi da andagi Mumbai da Tata da chatna ko mayam akogi cell ting na chatna meba aduna treatment si akoi nare ha matam da mapan da chatpani na akogi laijaramba paisa tum nun tumba andagi lying du da natana akogi chatpada matom da chatpa yadam ne ma ge family members kara hoga chatkani mari mata kara yaw chakani ada lairuba matam da chana ba thakna ba mayam sina mayam to matam da andagi language ki barrier ama leiba wa ngang ba akogi mi khara khatani akogi mapangi akoi Hindi khangde English khangde amna fluently ngang ba understand do ngam mi se adu khara am mi khara amadi si paw si inthin waina phawna bangam da ba adu adugumba barrier mayam do leibani na akogi Manipur gi scenario siga mapana tholaga leima tamda mapan gi di akogi metropolitan city site are go Delhi Mumbai mo sing sting yang matam da di mo si they are more affluent pesanang sa hana mo ne lai andagi lonely hare mo ne hana khangna bi heli ko aduna moigi asona kan da torok treatment si akoi sida direct inteto porok su ya deba aduna cancer gi treatment si su akoi Manipur gi scenario da di Manipur khatang gi wanate cancer treatment of gi haitara ga is going to be more of individualized mi gi matung in na akoi na noin individualized of da kar
my family condition su yengalga
yes ana khudamoina harabada hujikti anova treatment mayam lai ko cancer gi si immunotherapy kana ga lai ba sugum sing si hujikti oina di amna tangi expensive oi adana kara sesoi paisa nung sa khadana leijada ba mi sing si moi se afford to bungam da su dum yaoi ba adana si sing si yenguraga akoina no more individualized treatment amda ka lai
aduna more individualized treatment darka tabnina Manipur gi patient gi singi damakta more individualized customized oiba adugumba treatment tangai fade hen thambi bani adagi doctor dagi khangjaning baje hojikti hanam hoi mapa yam chatlamba hojik train je hongakpagi train je sum akoina ju ujarak pa haiba tare haibadi Manipur makta da hojik Carkinos cancer hospitals mai leire big facility building Porampata campus mai leire aduga expert doctors mayam leirabnina mindset je hanam mapa na chatragadi akoi treatment lying base yaroi having mindset da hongba change ama lakpa thengna bibra doctor
chume akoi gi hana chahi khara gi mamang da di akoi Manipur state da particular akoi gi cancer gi oiba akoi gi lying pham si mapung pha ba hai tare ga sin kya leiram de ꯍꯥꯟꯅ ꯂꯩꯔꯝꯃꯤꯁꯤꯗꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯃꯌꯥꯏꯕꯒꯤ ꯗꯣꯛꯇꯔ ꯑꯃ ꯇꯣꯉꯥꯟꯅ ꯂꯩꯔꯅꯤ ꯁꯔꯖꯔꯤꯒꯤ ꯇꯣꯉꯥꯟꯕ ꯑꯃ ꯂꯩꯕ ꯑꯗꯩ ꯀꯤꯃꯣ ꯄꯤꯕ ꯇꯣꯉꯥꯟꯅ ꯑꯗꯩ ꯃꯐꯝ ꯇꯣꯉꯥꯟ ꯇꯣꯉꯥꯟꯅ ꯂꯣꯏ ꯆꯥꯏꯊꯣꯛꯑꯒ ꯂꯩꯕꯅꯤꯅ ꯄꯦꯁꯦꯟ ꯑꯃꯅ ꯃꯥꯒꯤ ꯑꯅꯥꯕꯁꯤ ꯗꯥꯏꯒꯅꯣꯁ ꯇꯧꯔꯕ ꯃꯇꯨꯡꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯒꯦ ꯍꯥꯏ ꯇꯥꯔꯒꯗꯤ ꯇꯣꯉꯥꯟ ꯇꯣꯉꯥꯟꯕ ꯃꯐꯝꯁꯤꯗ ꯆꯠꯄꯗ ꯃꯣꯏꯒꯤ ꯑꯋꯥꯕ ꯀꯌꯥ ꯑꯃ ꯊꯦꯡꯅꯩꯌꯦꯕ ꯑꯗꯒꯤ ꯑꯇꯣꯞꯄ ꯑꯃꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯂꯥꯏꯅꯥꯁꯤ ꯗꯥꯏꯒꯅꯣꯁ ꯇꯧꯕ ꯃꯇꯝꯗ ꯗꯣꯛꯇꯔ ꯑꯃꯒꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯣꯑꯣꯔꯗꯤꯅꯦꯁꯟ ꯑꯗꯒꯤ ꯗꯤꯁꯀꯁꯟ ꯇꯧꯅꯕꯒꯤ ꯃꯇꯥꯡꯁꯤꯗꯁꯨ ꯈꯔ ꯋꯥꯠꯄ꯭ꯔꯥ ꯍꯥꯏꯅ ꯈꯜꯂꯤ ꯍꯥꯟꯅ ꯃꯃꯥꯡꯗꯗꯤ ꯆꯍꯤ ꯈꯔꯒꯤ ꯃꯃꯥꯡꯗꯗꯤꯀꯣ ꯁꯦꯝ ꯔꯨꯞ ꯑꯃꯗ ꯂꯩꯇꯕꯅ ꯑꯗꯨꯅ ꯑꯗꯨꯒꯤ ꯃꯌꯥꯝꯁꯤꯡꯗꯨꯒ ꯃꯔꯤ ꯂꯩꯅꯅ ꯄꯦꯁꯦꯟꯁꯤꯡꯁꯤꯅ ꯍꯦꯛ ꯃꯄꯥꯟꯗ ꯆꯠꯂꯒ ꯂꯥꯌꯦꯡꯕꯁꯤ ꯃꯣꯏꯁꯤ ꯑꯩ ꯉꯁꯥꯏ ꯃꯃꯥꯡꯗꯁꯨ ꯄꯟꯖꯈꯤꯕ ꯗꯥꯏꯒꯅꯣꯁꯄꯨ ꯇꯧꯔꯒꯗꯤ ꯀꯦꯟꯁꯔꯅꯦꯕꯨ ꯍꯥꯏꯔꯒꯗꯤ ꯃꯄꯥꯟꯗ ꯆꯠꯂ ꯂꯥꯌꯦꯡꯒꯗꯕꯅꯤ ꯍꯥꯏꯕꯒꯤ ꯊꯥꯖꯕ ꯃꯤꯠ ꯑꯃ ꯑꯗꯨꯝ ꯂꯩꯔꯝꯃꯦꯕ ꯑꯗꯨꯕꯨ ꯍꯧꯖꯤꯛꯇꯤ ꯃꯗꯨ ꯑꯍꯣꯡꯕ ꯐꯅ ꯌꯥꯝꯅ ꯂꯥꯛꯑꯦ ꯍꯥꯏꯅ ꯈꯜꯂꯤ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯏꯠꯁꯦꯜꯐ ꯑꯩꯈꯣꯏ ꯀꯥꯔꯀꯤꯅꯣꯁꯤꯁꯨ ꯃꯥꯒꯤ ꯁꯦꯝ ꯔꯨꯐꯇꯨꯗ ꯑꯩꯈꯣꯏ ꯁꯔꯖꯤꯀꯦꯜ ꯑꯣꯟꯀꯣꯂꯣꯖꯤ ꯁꯔꯖꯔꯤꯒꯤ ꯑꯣꯏꯕ ꯔꯦꯗꯤꯌꯦꯁꯟꯒꯤ ꯑꯣꯏꯕ ꯃꯣꯔ ꯑꯦꯗꯚꯥꯟꯁ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯑꯦꯗꯚꯥꯟꯁ ꯑꯐꯕ ꯃꯈꯜꯒꯤ ꯈꯨꯠꯁꯨ ꯈꯨꯠꯂꯥꯏ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩꯔꯒ ꯃꯩ ꯌꯥꯏꯕꯒꯤꯀꯣ ꯑꯗꯨꯗꯒꯤ ꯑꯃꯨꯛ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯍꯤꯃꯥꯇꯣꯂꯣꯖꯤꯒꯤ ꯑꯣꯏꯕ ꯂꯤꯀ꯭ꯌꯨꯃꯤꯌꯥꯒꯤꯀꯣ ꯕ꯭ꯂꯗꯀꯤ ꯑꯣꯏꯕ ꯀꯦꯟꯁꯔ ꯁꯤꯗꯁꯨ ꯂꯣꯏꯅꯃꯛ ꯄꯨꯂꯞ ꯑꯣꯏꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯕ ꯌꯥꯔꯕ ꯑꯗꯨꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯥꯏꯒꯅꯣꯁꯇꯤꯛ ꯐꯦꯁꯤꯂꯤꯇꯤꯁ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯔꯦꯗꯤꯑꯣꯂꯣꯖꯤꯒꯤ ꯑꯣꯏꯕ ꯁꯤ ꯇꯤ ꯑꯦꯝ ꯑꯥꯔ ꯑꯥꯏ ꯄꯦꯠ ꯁ꯭ꯀꯦꯟ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯦꯊꯣꯂꯣꯖꯤꯒꯤ ꯄꯥꯔꯠ ꯅꯣꯏꯅ ꯃꯐꯝ ꯑꯃꯗ ꯄꯨꯂꯞ ꯂꯩꯔꯕꯅꯤꯅ ꯄꯦꯁꯦꯟꯅ ꯂꯥꯛꯑꯒ ꯂꯥꯌꯦꯡꯕꯗ ꯃꯐꯝ ꯀꯣꯏꯆꯠ ꯆꯠꯄꯒꯤ ꯑꯋꯥꯕꯗꯨ ꯂꯩꯔꯔꯣꯏ
The single roof ꯂꯣꯏꯅꯃꯛꯁꯦ
ꯁꯤꯡꯒꯜ
ꯂꯩꯔꯦꯕ
ꯔꯨꯞꯇ ꯄꯨꯂꯞꯇꯨ ꯅꯣꯏ ꯂꯩꯔꯕꯅꯤ ꯑꯗꯨꯅ ꯄꯦꯁꯦꯟꯅ ꯃꯥꯅ ꯆꯠꯄꯒꯤ ꯑꯋꯥꯕꯁꯨ ꯂꯩꯔꯔꯣꯏ ꯄ꯭ꯂꯁ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯣꯛꯇꯔ ꯃꯁꯦꯟꯗꯁꯨ ꯄꯦꯁꯦꯟꯗꯨꯒꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯀꯔꯤ ꯇꯧꯒꯗꯒꯦ ꯀꯔꯤ ꯂꯧꯈꯠꯀꯗꯒꯦ ꯍꯥꯏꯕꯁꯦ ꯑꯩꯈꯣꯏ ꯃꯁꯦꯟ ꯗꯤꯁꯀꯁ ꯇꯧꯅꯔꯒ ꯀꯟꯐ꯭ꯌꯨꯖꯟ ꯑꯝꯇ ꯂꯩꯇ꯭ꯔꯦꯕ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏ ꯁꯤꯒꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯑꯃꯅ ꯌꯥꯝꯅꯁꯨ ꯃꯔꯨ ꯑꯣꯏꯕꯀꯣ ꯀꯦꯟꯁꯔꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯕ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯕꯣꯔꯗ ꯐꯝꯕ ꯍꯥꯏꯁꯦ ꯃꯄꯥꯟꯒꯤ ꯍꯣꯁꯄꯤꯇꯥꯜꯁꯤꯡꯗ ꯑꯩꯈꯣꯏ ꯑꯗꯨꯝ ꯇꯥꯔꯝꯒꯅꯤ ꯇꯥꯇꯥꯗ ꯆꯠꯄ ꯃꯇꯝꯗ ꯃꯣꯏꯗꯤ ꯕꯣꯔꯗ ꯐꯝꯃꯤ ꯍꯥꯏ ꯕꯣꯔꯗ ꯐꯝꯕ ꯂꯣꯏꯔꯀꯥꯟꯗ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯗꯣ ꯍꯧꯋꯦꯅ ꯁꯤꯒꯤ ꯄꯣꯠꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯥꯔꯀꯤꯅꯣꯁꯇ ꯃꯁꯤ ꯌꯥꯝꯅ ꯃꯔꯨ ꯑꯣꯏꯕ ꯑꯩꯈꯣꯏ ꯁ꯭ꯇꯦꯞ ꯑꯃ ꯑꯣꯏꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯒꯤ ꯁ꯭ꯇꯦꯞ ꯑꯃ ꯑꯣꯏꯅ ꯁꯤ ꯂꯧꯋꯤ ꯑꯦꯕ꯭ꯔꯤ ꯄꯦꯁꯦꯟ ꯈꯨꯗꯤꯡꯃꯛ ꯂꯥꯛꯄ ꯈꯨꯗꯤꯡꯃꯛ ꯑꯩꯈꯣꯏ ꯕꯣꯔꯗ ꯂꯣꯏꯅ ꯐꯝꯃꯤ ꯕꯣꯔꯗꯁꯤꯗꯩꯁꯤꯗ ꯇꯧꯔꯤꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯁ꯭ꯄꯤꯁꯦꯂꯤꯁ ꯃꯌꯥꯝ ꯑꯃ ꯃꯥꯒꯤ ꯐꯤꯜꯗꯨꯗ ꯍꯦꯟꯅ ꯈꯪ ꯍꯩꯔꯕ ꯃꯌꯥꯝ ꯑꯃ ꯁꯤꯗ ꯂꯩꯔꯤꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯃꯅꯨꯡꯒꯤ ꯗꯣꯛꯇꯔ ꯃꯌꯥꯝ ꯑꯃ ꯌꯥꯎꯔꯅꯤ ꯗꯣꯛꯇꯔ ꯁꯤꯒꯤ ꯑꯩꯈꯣꯏ ꯍꯣꯁꯄꯤꯇꯥꯜꯁꯤꯒꯤ ꯅꯠꯇꯕ ꯃꯄꯥꯟꯒꯤ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯑꯇꯣꯞꯄ ꯀꯥꯎꯟꯇꯔ ꯄꯥꯔꯠ ꯀꯥꯔꯀꯤꯅꯣꯁꯀꯤ ꯑꯣꯏꯕ ꯁ꯭ꯄꯦꯁꯤꯂꯤꯁ ꯃꯌꯥꯝ ꯑꯃꯁꯨ ꯌꯥꯎꯒꯗꯧꯔꯤꯅꯤ ꯄ꯭ꯂꯁ ꯏꯟꯇꯔꯅꯦꯁꯅꯦꯜ ꯑꯣꯏꯕ ꯃꯣꯏꯁꯨ ꯑꯗꯨꯝ ꯌꯥꯎꯔꯤ ꯑꯗꯨꯅ ꯄꯨꯂꯞꯁꯤ ꯑꯩꯈꯣꯏ ꯐꯝꯃꯤꯟꯅꯔꯒ ꯃꯜꯇꯤ ꯗꯤꯁꯤꯄ꯭ꯂꯤꯅꯔꯤ ꯇ꯭ꯌꯨꯃꯔ ꯕꯣꯔꯗ ꯚꯔꯆꯨꯋꯦꯜ ꯇ꯭ꯌꯨꯃꯔ ꯕꯣꯔꯗ ꯍꯥꯏꯅ ꯍꯥꯏꯀꯣ ꯁꯤꯒꯤ ꯄꯣꯠꯁꯤ ꯄꯨꯂꯞ ꯐꯝꯃꯤꯟꯅꯔꯒ ꯀꯦꯁꯁꯤ ꯑꯩꯈꯣꯏꯅ ꯊꯥꯡꯗꯣꯛꯑꯀꯥꯟꯗ ꯃꯥꯒꯤ ꯑꯅꯥꯕꯁꯤꯅ ꯁꯤꯅꯤ ꯁꯤꯗ ꯁꯤꯒꯤ ꯏꯟꯚꯦꯁꯇꯤꯒꯦꯁꯟ ꯇꯧꯕ ꯃꯇꯝꯗ ꯁꯤ ꯐꯪꯉꯤ ꯃꯥꯒꯤ ꯂꯥꯏꯑꯣꯡꯅ ꯁꯤꯅꯤ ꯍꯥꯏꯕ ꯃꯌꯥꯝꯁꯤ ꯂꯣꯏꯅ ꯄꯨꯊꯣꯛꯑꯒ ꯄꯨꯂꯞ ꯅꯩꯅꯔꯕ ꯃꯇꯨꯡꯗ ꯑꯅꯥꯕꯁꯤ ꯃꯥꯒꯤ ꯆꯞ ꯆꯥꯕ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯐꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯁꯤ ꯑꯣꯏꯔꯅꯤ ꯁꯤꯗꯩ ꯍꯧꯔꯁꯤ ꯍꯥꯏꯕꯁꯤ ꯑꯩꯈꯣꯏ ꯕꯣꯔꯗꯁꯤꯗ ꯗꯤꯁꯥꯏꯠ ꯇꯧꯅꯩꯌꯦꯕ ꯑꯗꯨꯅ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯜ ꯑꯃꯈꯛꯀꯤ ꯗꯤꯁꯤꯖꯟ ꯉꯥꯛꯇ ꯑꯣꯏꯗꯦ ꯑꯗꯨꯅ ꯁꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯍꯧꯕꯒꯤ ꯑꯣꯏꯅ ꯁꯤ ꯗꯤꯁꯤꯖꯟ ꯃꯦꯀꯤꯡꯁꯦ ꯁꯤ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯁ꯭ꯇꯦꯞꯅꯦꯅ ꯑꯩꯈꯣꯏ ꯂꯧꯖꯩ
Thank you, Doctor. Aduna Karkinose, it's not only Manipur Katangnati, it's national level, international level, the experts mayam yauraga, adumaina chain ama cancer care gidamakta aduguma leiba hospital network ama oibanina. Aduna any patient Manipur gi cancer care Karkinos hospital lakma tamda mogi lying pathapse kamain sathagadage habse expert mayam zigi board adumaina meeting phamaga best treatment options in locally have to do doctor and thambibani mathang ne have doctor thingujam james lakjage doctor akoina cancer ji my last stage to go ita di akoina best option pi bataraga su magi lying pathap sidi kitang di why have a challenges me am le du but akoina yam nganna screen da hobo taraga di khangdo hobo taraga di lying pathap sa thaba da yamna lie haibase doctor experts sing hanjan dum hairba wafam ni but today's the awareness is adum khara dum wat pra cancer have taragadi changu hospital da changu gadawo kitang ki bo phawba duga cancer ri ai screen ga tawba chatpaje ai ji cancer narak torebra habagi ki bo phawba swai ji kitang myth ama lebi je khara bust to view aduga early screening gi importance se khara highlight to view doctor
hoi yam chumbo wafam ne akoina cancer bu hair di mayam je ki ba haitare adagi kano tawba se loin tawne yaman kayo di cancer bu naragadi end stage ne na mayam lo khangne to khanei haitare ko aduda akoina tawba se usually screening hai akoina hai je cancer je detect tawge have na te akoina screening hai se sengna hai ragadi akoina screening tawba se mi khara na jum hainari moi masan as akoi de na ba yaude akoi de symptom kai gum ta leite adune screening tawba gi atha thokte kote na hai base jum hainai ado main purpose for screening the anabada screen anabada tawgadab natte nadriba mi to ado screening tawgadab ne haibagi atradi akoina screening je tahou targa di ngalingai da samna haida kan the example oina cervical cancer gi screening hai nangang khau muchin gi se si se akoina screening tahou targa di kamain to ga kan da magi changes ama haibagi atradi cancer di yaudriba pre cancerous state haitare cancer maksu yaudriba cancer da gi normal da gi kitang lanjal laba haitare sigi mafam juda akoina thengna hoktar targadi icham chamba procedure am tawraga yam kuida ba haitare ko procedure macham tawraga sidagi sig laying pa thapse tawraga mangon dagi haiba cancer ji olhandana ba treatment je tawanga me haitare aduga mayam ngai du akoina screening tawse hai se akoina cancer do yeng kanda ma se cancer do diagnose tawkanda cancer treatment do tawga have natte akoina hai at least cancer do on the prevention hana tahosi haiba gi wakolon ni adu mayam da jo akoina awareness mayam jo pire adu ai jo mi gai kitang reluctant oiba hai tar ki
hostile
ba
oiba individual se thengnarakpra sigi matang
kai do ba
hostile oiba kitang sauning buga
yai
pawba
gi thengna ye moida samna kanda akoina akoina field daga chatlaga akoina awareness akoi carcinosis dum continuously dum field da chatlaga dum akoi awareness pi ba adagi screening pi ba se screening to wai di akoina khuju khlai pu dharaga makhada ada angang khau gi machin gi test to ba adagi breast se kamai to examine to ni ga moya tak ba amasung akoina akoi gi doctor chatlaga moi gi examine to raga to bu matam sida mi khara tholak pa yaure tholaga su akoina the minus screening to se ha matam the hector saurak paga su yawe kai dobi to doina to roi gan haiba mi kharam di harau harau na hai di smine to re adu di to thok si have the harau na adu di akoi to thok sage haiba su konga am yawe adu bu akoina thengnar bu matam da hostile oi su dum yaw da natte yawe hai tare aduga
adu minor hostile oiba or kind of minor screening to the kizaba mioi sing the kari paujil di thambining bage doctor
paujil hai taragadi sengna haragadi akoina nupi oibida main oina screening to bose cervical screening sim din yom chulo to ko phai kai no hai je akoina screening to sai je aina pame akoi carcinos na pame haraga to sai have natte all over world da chatna bi duni to sai hari se kai no hai tai akoina khange cancer se up to some extent preventable ni haibase haibadi preventable ni haibdi nganna khangok taragadi adu nganna khangok taragadi treatment je phajana to bi taragadi at least icham chamba procedure macham targa pre cancerous condition da thengna hu taragadi maje outcome yam phajayena adu na tabida phajana full blown cancer ga taraga laku matam da treatment to taragadi emotionally financially family gi oiba paisa ju changba amu to oiba adu mathak tong outcome ju akoi pre cancerous ka yengu matam da cancer ga yenga matam da pre cancerous na outcome jam phajabani na akoina mangjong na treatment to mangjong na akoina screening ta hotar gadi masi yam kanagani aina khanse
dei doctor akoina national level gi data yang pamatam aduga manipur gi data yang pamatam da yamna khena baje leibra doctor gi personal experience hoje carcinos imphal da thabak to matam da mayam thengnarak pada unique oiba manipur gi scenario ju khara thambina ba haizari
lei haibagi arthis usually akoina manipur da yengu matam da as cancer per se da hai matam da akoi manipur da na samna kan head and neck kumba cancer or otherwise esophagus kumba nupidan cervical cancer ke kaje more haita yamna ui haita akoi gi manipur da se ayamna jo tobacco gumba chaba khotpa sidagi ayamna oigadra na khalle adu akoina sida carcinos suppose cancer nare hairaga la aga jo akoina sida samna kan da ma screening to la diagnosis to matam jo first akoina usually patient amasung patient party da akoina experience hai targadi usually moi the patient party the break hek nuai ta pau hai taren break to khotpa to je sudden break to na matam khar lauraga moi da hai tare patient da smine tawraga nangi disease is smine tawre cancer is smine tawre hai poto magi condition laong almasung stage e ka du niom chumna takpi ba hai tare sidadi kitang di phabra na khalle ina ai wakhanda.
Thank you so much, Doctor. Matang ashwada attend ba commercial break lawjagi break matung da we have two more expert doctors adagi moidagi cancer laina sigi matang aduga treatment facility gi matang
ꯏꯔꯛꯑꯣ ꯑꯩꯈꯣꯏ ꯃꯇꯦꯡ ꯁꯣꯏꯗꯅ ꯄꯥꯡꯖꯒꯦ
Break ki matungda amka hana taram nokchari. After the break, I would like to come to you, Dr. Pallavi Mehta. Doctor, when we talk about blood cancers, leukemia, lymphoma, and bone marrow transplants, these are treatments families in our state always had to travel outside, long distance to get the treatment. So could you please tell us plainly what a blood cancer transplant is and how this advanced care is finally available right here in Manipur?
So thank you for such an important question. It's a really important question, and with this question I would like to tell everyone to remove their fear of blood cancer. So most of the patients, they are thinking that having a blood cancer is like a death sentence. But nowadays having a blood cancer is not like a death sentence. We do have a cure for many blood cancers. Patient can live a normal quality life and patient can have a long-term disease control. So first of all, we should burst this myth that having a blood cancer means that patient will eventually going to die within a few months. So for blood cancers treatment, we usually do chemotherapy, and for most of the patient, chemotherapy is enough, but not all the patients chemotherapy will be enough. So in those cases, we decide, depending on the indication of the blood cancer, we decide which patient will need bone marrow transplant. So in a common term, we call it bone marrow transplant, but in a medical term, it is actually the stem cell transplant. We do not take the bone marrow cells from the donor, we just take the stem cells. And the process of stem cell donation is not like a surgical procedure. It is just like as simple like donating blood and platelets. So most of the donors, they are afraid of donating stem cells because they think that it is like a surgical procedure. They will have to undergo a big surgical procedure under GA. So they are reluctant to donate your stem cells. So it's just a simple process. We can donate stem cells just like we are donating platelets. Okay? So in a bone marrow transplant, what we do exactly is we eradicate the diseased bone marrow of the patient. So I'll tell you the concept, what is exactly the bone marrow transplant. We eradicate the diseased bone marrow with the chemotherapy and the radiation. We make the space in the bone marrow of the patient so that the stem cells from the healthy donor can be transfused to the patient. And the transfusion of those stem cells is also just like a blood transfusion. It's not a surgical procedure. We are not taking the patient in the OT. We are not doing any big surgeries. It's just like a simple blood transfusion. We can infuse the stem cell, healthy stem cells into the patient. And those healthy stem cells will eventually make the normal blood cells, like a normal hemoglobin, normal platelets, normal WBC, and a normal immune cells. So these immune cells will prevent the relapse of the disease for the rest of their lives. So this is the basic concept of stem cell transplant. Now the question is, who could be the donor for these kind of patients? So the donor mostly is in the family members. So your brother, your sister, your parents, mother, father, even your grandparents, even your children, even a children as small as 1 year old can be your donor, stem cell donor. And it depends on the HLA typing. There's a test called HLA. We do the test. It is just a normal blood test. And after checking the HLA typing, we determine as a hematologist, we decide that which is the best donor for that patient. And we take that donor for the stem cell transplant. So this is the process of stem cell transplant, but it is not an easy process.
It's not an easy process, but doctor, you're saying all this facility, this testing process, this treatment facility is already available here at Karkinos in Imphal.
Yes, so we have all the diagnostic tests which is required, the transplant. We have the expertise also. We have a doctor, like I have joined as a hematologist here. So in that sense, we have everything here, and so we need to now select the patients. So patient selection is also very important. We now need to screen the patient. We now need to make patient aware that this facility is available in Karkinos, so that patient should be aware whether his disease needs transplant or not. Most of the patient, they don't even know whether their disease, the hematological disorder which they are suffering from, they need transplant. So first of all, our vision at Karkinos is to develop a good hematology services and make people aware of the hematology and guide people whether their disease needs transplant or not. So that is our basic aim right now. And in near future, we are definitely going to start our transplant unit so that we can do both autologous and allogeneic stem cell transplant, so that people don't have to travel to the faraway places. So till now, people are traveling to Delhi, CMC Vellore, and because this is not a one-step treatment. it needs a long follow-up, even up to 2 years sometimes. So staying Vellore or Delhi,
Out of
Kolkata for
station
2 years
mhm.
is impossible. It is exhausting mentally, physically, financially, and emotionally. And sometimes patients do not follow up to these places and they come back to home. And the things get complicated, then all the hard work which they have put in the transplant is just wasted because the follow-up was not the proper thing. So that's why we need, Northeast state of India needs their own transplant unit, their own hematology center. So that is the basic vision we have at Karkinos right now, to start a transplant unit so that patients do not have to travel to faraway places and they get the standard evidence-based protocols which they are getting at the Vellore, the same treatment they will get here, but at the ease of being at home with the family, because after all, at last, home really matters. It really matters that patients should stay with the family members, and because it's a lifelong treatment. So yes, so that is our basic target and aim to start hematology.
Thank you, Doctor. Doctor, na tapu baze hozik blood cancer masigi lai pathap si jo koi Manipur Karkinos Hospital da magi loimak treatment sigi expertise mayam lai rehan takpi bani aduga masi long term treatment oiba aduga stem cells na chingba magi treatment mayam ama lai baze se expertise mayam lai re process mai tauba ya badi mayam lai re aduga karigumba patient amana Manipur gi wang ma da satpa tar ga ting masi long term oiba adugumba treatment method sahi ani hum changna mapanda lai badudi patient ki damuk so awaba mayam ma thengnar ka doriba aduna sigumba mayam treatment facilities je akoi Manipur da leirabani na Manipur si matang da public na awareness leiba taragadi Manipur da dum treatment chathabada patient ki damuk ta su khudong cha da mayam leibadu hanthan bangam gani family ki damuk ta su khudong cha da mayam hanthan bangam gani hadi mapana sapadi yamna challenges miyam lai gidoribani na aduna sigi awareness se leiba taragadi sida dum inak nagna yum manakta inak nagna smaina facility miyam je khudong chaba lawiba yagani habegi doctor gi admaina doctor na thambi bani. Doctor, I would like to ask another question. When a local patient receives a complex diagnosis, how does Karkinos digital backbone ensure they receive the best possible treatment plan without having to fly to metropolitan city?
Sure. So this is also an important question, because now this is the digital age, and at Karkinos we always tell it's a technology-driven healthcare system. So firstly, we need to understand whenever a patient has been diagnosed with a cancer, so it is such a difficult time for the whole family. Not even the patient, it's a very difficult time even the family to go through the whole journey of the treatment. And every patient deserves to have evidence-based standard protocols without any compromise in the quality care. So we at Karkinos believe in this concept to provide health care which is evidence-based and protocolized, and every patient, irrespective of their background, they should receive that standard treatment. So that's why we have developed a digital platform, and we utilize this digital platform a lot in the form of a virtual tumor board meeting. So none of our protocols are just like a physician's personal opinions. So we usually have a virtual tumor board meetings regularly, where we connect our local doctors here in Manipur with the experts who are working in the leading centers of Delhi and even in the abroad as well. We connect with those experts who are working as a very experienced doctors in their field. We discuss each and every case in details, fine details, and we consider all the multiple factors, even related to their financial factor, their social factors, and then we customize the protocols depending on the patient scenario. We tailor-make their protocols so that patient gets the best standard protocol and without compromise on the quality. And patient doesn't need to go to Delhi, Vellore, and to big places to get the same treatment there, because we are also following the same treatment protocols. The quality is same. So we can assure patients that even in the comfort of their home, they are getting the best treatment possible. Because as I said earlier, home really matters in the case of cancer patients, and staying with the family and staying at home, it really matters.
Thank you, Doctor. Doctor, takui bazi hozik digital era zu area duna Karkinos ki magi digital backbones raise the haidi magi international level the leba national level leba experts mayam je tanaraga patient magi treatment je lying pathap satha bada mayam je hojikti digital era zu ne mayam je connect toraga tato tashin toraga best treatment option patient ki damakta the minor doctor singna decide tawe hena ꯊꯝꯕꯤꯕꯅꯤ. Thank you so much, Doctor. Makha tarakpada Dr. Konjam Jina Devi lakchagi. Doctor, okay, cancer gi treatment je ma je yamna arriba treatment dina tamina sel yam changma. Aduga especially for family coming from lower income, even for everyone, it's a very expensive treatment. Aduna financial gi burden cities masi kamai na yeng bibiya bage. Aduga here at Carquinos for families facing financial constraint. Aduna moigi cancer patients singi damakta any special package swaise khathambi.
Why is my name? I am a cancer patient last person which the Manipur gi almost I am economically young people soap I am like go. Adagi ho economically stable over lai adabu cancer gi lying pathapasida treatments is hang chathaga delivery go. Masida ko hek diagnose to padeki ko. Ko diagnosis teki hoga treatment chathabagi mayam sida sales nungsu yam changi ko. Imung munung smile haine ko na cancer ki treatment obasda patient na te imung munung pu yauna treatment to gidore gari habidi magi psychological ko the social economical ko gi loina maksi drain to rakadore gari na akoi gi Carquinos ta ko Ayushman Bharat PMJ gi facilities available oje adagi ko gi chief minister gi haksel gi tengbang hai tare ko CMST card see for patient ki package dum lo yause starting from we diagnosis ki test nung to khotpa ko adiki treatment chatharapa whether it be surgery ki wagera adiki chemo ka po wagera radiation ki wagera ko see actual ki tengbang ki group ai tai ki PMJ ga kino si da chief minister ki actual ki tengbang da loina coverage pb hai tai adiki amana koi ki third party administrator insurance ki sisu on the process the delay je.
Okay. Samna harbada ji Carquinos Cancer Hospital je empanel for PMJY aduga CMHT aduga insurance ki ju other way my lady have Dr. Makhada na khangjaning basi hoji akoina patients sing je ICU da thamba je ICU gi si ju yamna arrive dina te masi yamna important jo ba critical care da makta do ICU da bu tham dar ga the end of the life or bra haina patients in the zoo, family members in the Nunang Mapawa. Ado ICU da Tambagi, my critical care importance to highlight of you, ICU Zizu Yam, the Tango or Vizala, so I highlight of you, doctor.
Siki question see Yam Namaru of the question. I did cancer treatment, Chathar Pasida. On the whole, Tang with Natanako, ICU care of Kona, patient the Dakar or a Pagipum like. I am with the queen on critical care, Haitariko, on Kogi ICU. Atopa ICU ba khina ba khara sulai ka on ko gi ICU de ko na am matam da ko surgery to ro patient hai tare post surgery da surgery su achong ngak to oi am matam da cancer ki patient hai bas da masa hana da gi atopa atop patient singa di kitang am immunocompromised oi ba adi immunity down chala ka pa infection am prone oi gan ba dum oi gan adagi atopa patient ko cancer ki treatment chatharaga chemo radiation nung chatharaga sudden magi organ ama so hanga warakpugumba adumba patient admit to badum thingna jai ko ICU da adagi atopna akoi palliative ta somna hangbiri ba jeshuna hangbiri palliative ki end of the life care dang thamra haibi ki question ma lai ko nach adu nachade akoi sida palliative ki oina tongana dedicated group ama leje ko unit ama leje under Dr. Nandan Chaudhary na ko mai makhada leje palliative si akoi gi hana dikhane only at the end of the life care ko patient sigi yaratra bukanda when all the treatment modalities have failed ko palliative to the chathabra haibadu madulale palliative care si akoi di hana hek diagnosis ho badagi starting from the treatment digi dum incorporate torga chathamine hai tare ko the palliative se the koi je haining is concurrent palliative care hai tare ho badagi diagnosis hek khang badagi ulapna loina ragadum chatminaba masi sigi advantage na kai doge habida patient the quality of life se improve to behavior adagi patient the financial burden adagi koi psychological social economic burden man su handai adagi ngasa in haije gi cancer amagi lying patap chathabada patient the nate lying bise magi family su involved to godaba from the very beginning si sina moi the burden stress hai ya aduki matik handai hai tare aduna akoi gi Carquinos study palliative ki care si akoi dedicated unit oina lejai ko aduga haurakpadaki hauna incorporate tawjai masi mayam gi mit ni hai tare ko only at the end of life care have si
masi aram po ni koi horak padi hong na incorporate torga patient si magi end of the life lakung ka kanta ko yam na dignified way da ko yam dignified way da masagi own will da patient khara dum koi advanced directive kan nei je ko haidi cancer nara kansta ai ni sagi ko na khengwai matam du yok sala e haiba kan ko karam haina kamaina plan tor phazana koi gi DNR ka dino resuscitate kan lei adigi aingo da ko na chup happy ga no ICU da ko adugi mayam ama lei si ma'am si patient masamang no willingly sign tor ba yai ba koi gi living will na ko or all aduna tragasu man atop magi koi gi kaini surrogate hai tare magi kan magi representative oina ko aina sumaina decision lo bangam dar kanda aigi da makta decision lo bi na hai tare ko adumaina adu po adu haidi yang well dignified oina azana care pibi bedo ko magi end of the life care rakpa kanda adu gi face loina mak koi ka kinos la je hai tare
palliative care gi matang da zu akoi gi public na awareness kitang wat pra haina zu dum khanjai aduga but hozik Dr. Nandan Chaudhary magi me makada yamna di mai wave su kan di kan khalak pa male Manipur da doctor ni khangjaring baje doctor na hozik family bhawa moi counseling pi ba khot pa incorporate loin tawe habni na in what manner hozik ki cancer patient ki family sing je sida carcinos ki site gi moi da kamaina ready to hanba or kamaina moi bu patient this mai na re khole maunda cc thenak pe ha ba gi challenges me am da moi da hana adapt to hanba ge si gi roles ji kitang highlight doctor
patient the palliative care ki makhada lakpa bi ko palliative care ki the smaina patient se magi end of the life care kai pasagi all the treatment modalities me am se loina ma yadre haira kanda leiba kanda ko patient ki family si di hobadagi to point knowledge pasana pipi raga ko adagi suppose ina harjani the organ no haira ne oral cancer guma haira patient se koi ki yam bleed to gan ba koi ki treatment modalities koi radiation to gare ko kare adu erga su thing bu kai no ma adi ko na bleeding to ya khot pa adi patients in hogot pa khot pa ngamdre adi puto pusin la ko sum ngamdre hai ba kanda ko gi team madum home visit no madum chatti ko aduga no last ki magi masa yam so chalak pa warak matam hai tare ko adum kanda bleeding mu yam to rakan sida ko gi e orak pa e ha ba adum to kan sida imung manu family caregivers sing na e ubada da ko gi haksang da tuzungam painingai gum ba oi ba ko adum ba tholpa kan de khoina sumaina bleeding gum tawre khole haraga di patient se khoi towel khoi dark color towel hai tare ko bleeding to khole ha kan aduna phajan bi mention bi ko habidi e do color machu awaw gum oiraga di e machu do ubada da khoi panic to ga da ko aduna dark color gum towels na so khoi e do tholpa kan namjan bi pressure pb ba khotpa do eraga di panic to bodo handhana ba ko habidi I say palliative care ki da when all the treatment modalities have failed ko aduga khoina atopa option later ba kan da ko adumaina su patient counseling proper guidance ko aduga khoi holistic way the approach to adumaina loina je hai.
Thank you so much, Doctor. Mathang da ha Dr. Thangjam Nirpendra da mulak jage. Doctor, when hoigi treatment je mai multiple steps involved or kadaba surgery kumba yaw kadaba precision radiation kumba yaw kadaba sikuma mayam je lak matam da di kamaina approach to boge doctor.
Sigi kana se wafam se akogi cancer na ko matam da cancer ki treatment se apne sanali camera ma leiba matam da ma stabilize to na bage ko tripod am changi ko adoi to na cancer ki treatment da su samna have tripod am chang bu samana ye makhong amana akogi medical oncology ki chemotherapy aduma talang ta ka pa to pa ma atopa makhong amana na sai surgery ki pa andigi atopa amana sai radiation ma ya bi ki pa aduna cancer se treatment to matam da ayam matam da hujiki hariba modalities ahum se am changi surgery khatang to ga loi bana to bana to radiation khatang to loi bana to ba the chemo khatang to loi bana to ba to ain to bana hariba modality ahum se noi chang bana ayam bo oi bani na aduna patient amma lakma matam da moi do properly treatment holding ai da sigi modalities me am changa kani have moi do properly explain to ba counseling to ba ma change that we always do at the am patient could be no patient plus family members may am say no counseling no people and the patient china akoigi assign panjagi ba same group ama da high modalities me am say no leibni na patient na mafam ama dagi surgery dagi and dagi asagi chemotherapy gi medical oncology gi part and dagi radiation oncology part is lab na no chat pagi kesu darkar leitrebo koi same roof ta leibnina aduna they find it much more comfortable aduna moi siana comfortable oi harima constant noi phak leibnina ondigi doctor masen da su the communication gap later and the discussion nungai ba ko patient ki condition ki si leibnina si tawasi habi condition se nungai leibnina ko si process se makom sida noi leibin nungai ba le.
Okay, thank you so much, Doctor. Duga, Doctor, tagi among khangzaning baze, may amze patient as well as doctors, magi network or magi relations, yam close nita dum labra, masi kamaina maintain to wage phone call anytime patient na doctor the clarification pamatam anytime call kumata oraga dum mikudong chaba labra or hospital gigi site tagi timely basis ta dum phone to dana check to oraga patient gi health kuma inquire to khotpa si swise khartham.
Lazy, Madhu Kanaduma, Dr. Masingi Harakati, just never a communication gap, communication gap, late. Dr. Magaki, especially patient in Matanga power, Amana Magamina power, no pounding. And the Gia Topamana, Hugi, Lewis Nasana Panjaki, tumor botana. Treatment see how remoting the how to another tumor botama, multidisciplinary tumor botana. Virtual tumor botting to matung the treatments decide to matung the treatments horaga karigumba maratu da ana applicants in bani khangde any apagi changes sama la ko asset reassessment to matam da karimba treatments ponga da darkar leire natraga kari decision ama lo sige ha matam da su mari so koi punna mu phamina raga bot tumor bot ana mu phamaga mari da mu ko treatment decisions mu punna dominate ba andigi patient gi site ta koina patient na yum da leira kanda ko hospital gi site issue regularly call mandatory follow up ki follow up tawna team mamu leiri magi personal contact noina bo lawraga lei adana sida regularly phone tawraga patient gi matam da suppose akogi magi chemotherapy kapagi matam bu yawra e natraga amu investigation taw koi matam yawra recall akogi amu la aga ye follow up tawna matam yawra se patient regularly matam time to time akoi noina bo amu phone tawraga noina ba akoi contact tawra lei jai sigi potsima and the patient na karigumba hoida magiani gim the problem ama leire at the moment no item leire form of founding karimam hanging harabam matan the hospital la lapan nandraga su latring ida waraga su apai hospital gi mo contact number ama lei sida is mo contact tawraga ogi sigi through the tawraga apai experts into the mo contact founder kanda man patient na no item do karino haido adu yarigi apai patient na lapan namdraga su adu kan solve tawna bo hanase.
Thank you, Doctor. The Karkinos Cancer Care Cancer Hospital in Falls is a patient-friendly environment. Adukumba Laiba, Duma facility Laiba, Dum hospital ni. Matanga Shwada attend commercial break to Lojage, break Matunda, expert doctor Singa, rapid fire round. Zatazagi.
Welcome to Karkinos Manipur Cancer Care Institute and Research Center, the premier destination for total cancer care in Northeast India. Our state-of-the-art infrastructure offers a comprehensive range of cancer care services, from accurate diagnosis to personalized treatment and holistic rehabilitation. With advanced radiation therapy and high-tech machines, we deliver precise and effective treatments, ensuring the highest standards of care. Our team of highly experienced and qualified doctors utilizes modern technology, precision medicine, comprehensive chemotherapy, and innovative approaches to provide the best possible outcomes, making advanced cancer treatment accessible and affordable.
The Karkinos Health Center in Paul has started in full swing, and it is giving benefits to the poor patients and to the patients in the northeast region, especially in Manipur and the neighboring states. And we are giving it at a very affordable and low cost price, and also accessible. So affordable and accessible care for the cancer patients is the motto of the Karkinos Institute here in the Northeast.
Our multidisciplinary teams, tumor boards collaborate to create personalized treatment plans, ensuring each patient receives the most effective care. We prioritize patient well-being, providing emotional and practical support throughout their cancer journey.
I went to the Kurama Pata Pare and Lobayare, Hana, Lerman White, Walker and Toya.
Is the year Mikri, Kojode, Shijil Mokuduk, the poor Bana Hospital, Dunokalia, could victim. I just saw Bello, could Koso na mo dino.
ꯑꯩꯍꯥꯛꯅ ꯊꯥꯏꯔꯣꯏꯗ ꯀꯦꯟꯁꯔ ꯂꯩꯕꯗꯒꯤ ꯑꯩ ꯀꯥꯔꯀꯤꯅꯣꯁ ꯑꯁꯤꯗ ꯌꯦꯡꯖꯕ ꯂꯥꯛꯈꯤꯕꯅꯤ ꯑꯍꯥꯟꯕꯗ ꯑꯩꯅ ꯁꯤꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯕ ꯂꯥꯛꯄꯗ ꯌꯥꯝꯅ ꯀꯦꯄꯦꯕꯜ ꯑꯣꯏꯕ ꯗꯣꯛꯇꯔ R.K. ꯒꯧꯇꯝꯖꯤꯠꯀ ꯊꯦꯡꯅꯔꯦ ꯃꯍꯥꯛꯅ ꯑꯩꯕꯨ ꯂꯥꯌꯦꯡꯕꯤꯗꯅ ꯍꯧꯖꯤꯛꯇꯤ ꯑꯩꯒꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯂꯩꯔꯝꯕ ꯁꯦꯜꯗꯨꯁꯨ ꯂꯧꯊꯣꯛꯄꯤꯈ꯭ꯔꯦ ꯑꯗꯨꯒ ꯍꯧꯖꯤꯛ ꯅꯣꯔꯃꯦꯜꯗꯕꯨꯗꯤ ꯂꯩꯖꯔꯦ
Karkinos Healthcare. Care for your loved ones for a healthy and long life.
Break matungda amka hana taram nokchari. Doctors, now let's move on to quick fire round. So here I'm going to call out a common symptom and then or a scenario which we often worry about, and doctor can kindly explain what is it about in about 1 or 2 minutes max. So when is it an immediate warning sign to see a specialist, and when should we stay calm and not to panic? So first I would like to come to Dr. Thangjam Nirpendra. Your first question: a painful mouth ulcer or sore that pops up after eating something spicy. Akoina kariguma matsara matungda chinda ulcer thokpa pom thorokpa ado masigi scenarios.
ꯑꯩꯈꯣꯏꯅ ꯄꯥꯈꯠꯀꯗꯕ ꯀꯟꯗꯤꯁꯟ ꯈꯔ ꯂꯩ ꯅꯠꯇ꯭ꯔꯒꯅ ꯄꯥꯈꯠꯂꯣꯏꯗꯕ ꯑꯃꯀꯣ ꯆꯤꯟꯗ ꯑꯜꯁꯔ ꯑꯃ ꯂꯩꯕ ꯍꯥꯏꯕꯁꯤ ꯀꯔꯤꯒꯨꯝꯕ ꯑꯩꯈꯣꯏꯅ ꯂꯥꯏꯍꯧꯒꯨꯝꯕ ꯇꯧꯈꯤꯕ ꯂꯣꯛꯀꯨꯝꯕ ꯊꯨꯡꯕ ꯅꯠꯇ꯭ꯔꯒꯅ ꯑꯩꯈꯣꯏꯅ ꯂꯥꯏꯍꯧ ꯇꯧꯈ꯭ꯔꯒꯅ ꯏꯝꯌꯨꯅꯤꯇꯤ ꯁꯣꯟꯊꯔꯛꯄ ꯃꯇꯝꯗꯨꯗ ꯍꯦꯛ ꯑꯩꯈꯣꯏ ꯆꯤꯟ ꯄꯣꯛꯊꯣꯛꯄ ꯍꯥꯏꯅ ꯂꯩ ꯄꯣꯛꯊꯣꯛꯄ ꯑꯃ ꯌꯥꯎꯏ ꯅꯥꯔꯒ ꯀꯩꯝ ꯆꯥꯕ ꯌꯥꯗꯕ ꯊꯨꯞꯇꯅ ꯂꯩꯕ ꯑꯗꯨꯒꯨꯝꯕꯗꯨꯗꯤ ꯑꯌꯥꯝꯕ ꯃꯇꯝꯗ ꯏꯠ ꯍꯤꯜꯁ ꯕꯥꯏ ꯏꯠꯁꯦꯜꯐ ꯍꯞꯇꯥ ꯑꯃꯅꯤ ꯁꯤꯗꯩꯁꯤꯗ ꯂꯣꯏꯅꯃꯛ ꯍꯤꯜ ꯇꯧꯖꯩ ꯑꯗꯨꯁꯤꯡꯗꯨꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯊꯣꯏꯅ ꯌꯥꯝ ꯀꯟꯅ ꯄꯥꯈꯠꯅꯤꯡꯉꯥꯏ ꯑꯣꯏꯗꯦ ꯑꯗꯨꯕꯨ ꯀꯔꯤꯒꯨꯝꯕ ꯂꯩꯒꯨꯝꯕ ꯁꯤꯗꯩꯁꯤꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯛꯆꯥꯡ ꯈꯅꯥꯎꯒꯤ ꯀꯩꯅꯣ ꯃꯅꯨꯡꯁꯤꯗꯩꯁꯤꯗ ꯆꯥꯊꯠꯇꯅ ꯂꯩꯔꯕ ꯑꯜꯁꯔ ꯑꯃ ꯂꯩꯔꯕ it is painless ko hawakpa matamda nadaba ulcer ama leiraba painless ulcer leiraba but it does not heal ko heal to yadraba hapta ani hum sidaista adu itadi madu akoina section bam changi ko madu gido akoi experts inga tanaraga madu phattabo oibra cancer oibra habdu engthokpa ma changi.
Thank you, doctor. Painless ogadaba adu ulcer ma. The second question, doctor: a hoarse or changing voice after a bout of bad weather or flu. Khanaugi voice kuma change sorokpa after a flu kuma naru matungda masi chingna ningai oibra doctor.
Khon sidaba habsi akoina lokumba thunga kandasu masi kana tawi khon sidaba yawi andagi laina ngakta gi natabida akoina mi amana khon voice ne yam sijinaba singer gumba isai yam chutpa andagi teacher oza gumba ko andagi sports sanam tam yamna kan law khong tawraga su matam khara khon sidai but adugi singdudi voice rest taw kanda yamana phaglakani adubu karigumba haiba singse yaudabida khon se sidana sum laaba matam sana sidana laaba phagalaktraba adu itaragadi madigi potsima akoina yangjambam sang khon sibisi akoigi vocal cord ta vocal akoigi kanogi magia cancer ama leramba natraga nodules ama leramba yai natraga even lung cancer itself moina su consider hanba yai aduna yangjambam sang.
Thank you, doctor. Aduga ahum suba question: noticing a dark mole or spot on your skin that seems a bit dark. Koina sambrudi ma sambrudagi hena muba ma thengna ba taragadi masisu chingngai oibra.
Sambru si karigumba akoida hanadagi thainadagi sahi amani ka lisang sina lerba sambru oitaragadi karigumba ahongba leitraba madu yam kana kiningai oide tawgadabu karigumba nauna tholapa sambru natraga hana leramba sambru oijaraga su karigumba madu chawkhal aba magi border akoibasi akoigi diffuse oiba skin siga puras kana demarcate taw lei panataba ko andagi ngasagi sambruda machu hongakpa sambruda i tholapa gumba hagajaraga adugumba leirakpa aduga sambruda akoibada macha macha sambru anoba chongthokpa leirak taragadi masi akoina section gadabani misi yengsinba masangi koi skin gi sambru gi oiba adugumba makhal melana ma haiba cancer makhal amalai adugumba to oibra haiba yengba masan.
Thank you so much, doctor. Mathang da hak Dr. Thingujam James Lakjage. Doctor, finding a lump or experiencing pain in the breast.
Usually akoina breast apomba malaiba amasung nabase samna kanda usually period ka nupi oibigida di period ka sagona raga haita period matam daga naba khotpa tawbasidi kaisu akaiba leite na pai aduga hana apomba ju piaga leiba hana sangsana leirakpa haitare paibda samna kan nadaba or akanbo oina form oina oidrakanda di kaisu ga photo di aduga suppose hauji pochina khangsaw chawkhlapagumba oiraba adagi samna kanda akoina breast ge nipple discharge gumba lakpaga oitaraba adu oitargadi doctor ma tan thokpa mathau tai na khal.
Okay. Thank you, Doctor. Aduga anisuba wahangna feeling bloated or having gas after a heavy traditional meal. Saksa yam chasar malor kan na pukse yam na bloated feeling to was masi.
Usually bloating to ba hai ko ne kaino ma heavy meal gum char wa dum bloating to ba dum tong nei ko adu tawraga su sam nai kan da ko ne usually karam kan da kaino to ge hai ta dum kitang dang char ga dum bloated to dum lei ba hai ta aduga le sang sit na hai de kui na hai ta pukse dum ithan thalal lei he ga hai do
Yam chadraga su
yam chadraga su adu main to gon ba se kai kan da ko gi ovarian cancer nupi gi da hai ovarian cancer gum ba he ko gan ba yawe ko adugi symptom hai tare ko bloating adum to le se dagi sam nagan GI gi cancer gum da su adum thengna ba yawe aduna normal le ko gi cha heavy ga cha ga adum ngala ga phab du ki sukai din na tan le sang na hafta ma tham ka je du tham ni ga je ka hai tare kitang dang cha ga su adum ithan da thal le bi type to do adu itari doctor am to dan to
Duga Doctor gi hum suba wahangna spotting or a little bit of irregular bleeding between normal menstrual cycle. Hogi thagi hum ka plak bazigi marakta normal cycle ke manung da e spotting khara thengna batar gi akoi section masi is it a warning sign?
Sidasu sam na ga di akoi na spotting amrakum ga thengna ba hai tare yam hangai kem to dra amurtang ga thengna boi tar di sam na ga hormonal changes pu egera stress pu egera hai tare aduna maram oira kitang u basi dum yaune ba adubu repeatedly or frequently hadam toina intermenstrual bleeding the spotting urak pa ko adai samna postcoital bleeding urak taragadi kai lege haibadu ma kupna thigatum thoktai kai ginoi ta usually endometrium uterine cancer gi endometrium gi cancer umba oigan busu hek yawal le postcoital daga oiragan angang haumachin gi cancer ga hek oibiyawe aduna maina yengthoko phai or otherwise akoina khamba loigra matung da haitaren nupi na khamgra matung da chahi ma pura khamgre haire aduga marakta ga drop am tang du lak oi taragadi adu ma yengthoko mathok tai kai leige habadu ma kai ma adu poche samna ga postmenopausal bleeding ase magi symptom ma ne endometrial carcinoma gi oibagi symptom ma oibani na aduma yengthoko mathok ta ga ni kai leige underlying we should not ignore it aduma.
Thank you, Doctor. Thank you so much. Next, I would like to come to Dr. Pallavi Mehta. Your first question is, a small tender swelling under the jaw or in the neck during a throat infection.
Okay, so if someone is observing a swelling in the neck, and if it is associated with sore throat, cold and cough, normal viral infection, and if it is getting subsided within 2-3 days when the fever has gone, or if you have taken some antibiotics and the swelling has gone, it means nothing to panic. So it is just related to the infection, and do not panic, sit at home. You need not to see a doctor. But if the same swelling is painful, if it is increasing in size, it is becoming hard day by day, and it is not subsiding over the weeks, and there is no fever, you have taken antibiotics, still the swelling is there. So please you need to go to see a doctor, and you might need a biopsy also for that lymph node.
Okay, and the next question is losing a couple of kilos after starting a new diet or a busy month of physical work.
Okay, so if you are losing weight and if it is intentional, you are doing a lot of exercise, you are going to gym, you are doing yoga exercises, and you are taking care of your diet, then nothing to worry. It is just an intentional weight loss, and whatever you are doing to lose your weight, it's working on you. So but on the other hand, if that weight loss is not intentional, you are not trying to lose your weight.
No exercise, nothing, but
yeah, with no exercise, no dietary restrictions, still you are losing weight. And if it is a significant weight loss, like 5% weight loss in over the 6 months, your clothes are getting loosen up. So that's an indication that you should go and see a doctor. And especially if it is associated with fever, night sweats, lot of fatiguability, then definitely you should go and see a doctor.
Thank you, Doctor. Doctor, takui baze koi na hakchang ge koi weight se khakan handa batar ga di aduga fever, night sweat ga associate tawba admai thingna batar ga di doctor da tana bi ho haiba du thambi bani. Your next question is, Doctor, a sudden spike in fever that goes away after taking paracetamol.
Okay, so if you have a fever and you have taken a paracetamol and it's not coming back after taking paracetamol, most likely it is nothing to worry. It is maybe some common viral fever, and you need not to worry about that. But on the other hand, if the fever is persisting, despite you have taken a paracetamol, but fever is coming back after every day, every 1 and 2 days, and that fever is associated with other symptoms like extreme fatigability, weakness, some bleeding spots on the skin, rashes on the skin, or bleeding symptoms from any other sides, that means you need to check your complete blood counts. So it could be related to the hematological malignancy, and definitely do a CBC count and check with the hematologist.
Doctor na takpibase akoina fever je adum hidak char ga zu dum hanjan jan adum fever yam toin toksalaba aduga akoigi blood spot kumba thengnaba sikumba thengnaba targadi doctor tana biho haina thamibani. Thank you so much, doctor. Next I would like to come to Dr. Konzam Gina Devi. Your first question is suddenly feeling dizzy or faint after skipping a meal or standing up too quickly. Chakcha da bagi ko nga wo dera masi akoi chingan ngai oi brado.
Summer matam su lai ko matam se dum chane koi ising gum yam thaktra dehydrated oi ba kan da su sumba conditions dum thing nei ko adagi amana koi gi chak cha dar kan da sudden drop in the blood glucose level ko hypoglycemic episode chat pa this is especially in a diabetic patient gum da dum ko or nasai gi kok ngau ba khangai hai da du koi gi bp khang nem nem dharak gum ba koi si orthostatic hypotension hai adum ba se adum thing na ba yai ko si hoji summer lap matam sida ko ado koina karam haina prevent to kadage haibada koi chaba khopos ti koi small frequent intervals ta tang gap regular naina chabi ba ko adagi hogat pa khope matam da koi tumam badagi oire phukla hogat pa se koi bp sudden drop to ba ko adumai to ba zum thangale koi ahing da koi mapan to ke kain hogat pa da su sudden mi se collapse to ba yawe ba ko adum ba se ka do gap da koi ko ngau ba hairak pa adumai to ragadi Pamungi mapanda tapna hogatlaga pambiba aduga tapna hogatpiba khoi khanghoe hogataba ko sumase tobiba phayena khale ko adagi sugar wangomida khoi blood glucose down chapa kanda gyan khawang mangba yai ko adumbudo sugar gumba check tobiba aduga khoi my regular intervals chana ba khar khar dum ko small frequent intervals pibiba sumase mathau tai na khale bp wangomida bp regular medication chaba chadabra na check tobiba adumaina dumus mathau tai na khanche
Doctor, see the rapid fire question in another, but just in addition, Hyzabatare, Karkinos Cancer Care Hospital is the only cancer patient katang yang barana traga all other different kinds of ailments. So, yang barasi you can come here.
Akoy sa di kano tawag di cancer patients the mainly dedicated cancer dedicated hospital ne cancer ngak tagi oina yeng ko.
Okay. Thank you, doctor.
The non-cancerous over the su lak pa yawe hoy margin okay kano oina whether cancerous over non-cancerous over ko. Matang da sulak pa yawe yeng bu sudum yawe adubu mainly dedicated to the cancer haitare.
Thank you, doctor. Your next rapid fire question is: a person suddenly choked while eating or started coughing weakly and was unable to breathe. Hari cha matam da kudakta adum panba khutba ta wase
punba panba adum ba so ko si sudum khoi scenario adum thingnaba adum yauje ko sidai sida khoina yam thuna chaba ko yam thuna chaba wangang with the chak cha na cha ga no kaina khoin haini se asida sumba case dum thengna ba yawe ada makhan ani sui partial choking hai bam ga ko adagi full complete choking hai bam ga partial da na khoi gi ngasa gi khoi gi soron be gi airway gi passes hai tare si se kitang partially close oiba adum kan da di patient se amatam da mathan da lok ti khu bangam ni ba ko adagi ma adum khoina hai ba ko pa breath soron do ko pa duloi ngam gani adum matam da khoina karim ta to bada ka ta de just encourage the patient to cough up lok to kana khulna ba encourage to biba aduga condition am lai pura full choking to gi ba hai tare ko adugi universal khoi gi choking sai na ma khut sina khut either one hand or both hands ko sisina smaina khut na manga kram sila smaina paija ba hai tare ko aduga patient si khoi almost khoi gi blue machu jang salak pa so hon bangam da ba wang nang bangam da ba lok khu bu sungam da ba adum ba condition thingna ba yawe ko adum badana khoina tongan ba maneuver khoi gi Heimlich maneuver hai ko khoi gi patient si gi maning wai tang lepa ga hai tare ko aduga patient si gi abdomen mapa khoi gi sida khoidou mapa leise ko khoidou si gi kitang hek mata ka khatlaga khoi gi Heimlich maneuver na khoi gi khut sina sumaina tasalaga hai tare khut amana ko aduga fist oina khoi khutum tasalaga khubi sina puklom da sumaina inkhat pa ko aduga another hand sina aina maning nom de ki lepak toini patient sina mamang nom de lei toini ko aduga ngasai gi khoidou gi mathak te gi hai tare ko kan abdominal thrust se mangarak piba ko mangarak piba adagi maning nom de gi su koi back blow sina ko agi khubak sigi khunam hai tare sigi kidosna sisna koi shoulder gi blades da lei ko sigi marak sida mangarak piba 5:5 to piba maning dagi mangarak dagi mamang dagi ngasai khutum ta salaga to bose mangarak piba ko si se koi Heimlich maneuver ko koi no choking to bokanda sigi immediate kenose adi patient bu magi no tongnaba recover tongnaba hai tare ko aduda sometimes patient mana palli ba poto pai thor pudum yawe adagi sidagi hena yam henzel lakana hai tare patient se gyan mangi ba khot ki ba tor ba ko agi so holak traba adagi keno tawdraba mihun yaw taba khot ba tar ba ko CPR dum perform tawani ko
immediately doctor the rush to tare
rest of the time
adagi doctor gi third question an elderly person develops sudden weakness becomes less responsive or starts breathing rapidly at home
sisna koi ahal lamanda ko de kangle smina sum leimina madagi khangson sonjalakpa makhut masa khongkhut loinma sonjalakpa adagi soron ba se khangwa waraga adagi gyan mangi ba unresponsive oigi ba ko adum ba kanda koina kai to ga ge have se koi elderly patient ni chahi yama banina magi hanagi hypertension sugar ko gi problem diabetes adagi atopa heart ki disease mayam ama leiram ba yai ko aduna koi gi to oiba ya ba se stroke to ba yai heart failure heart attack to ba yai ko condition mayam ama leire adumba condition da koina kai dogada ge have da patient se hana koina magi response hani yengani ko phasana gyan lei ibra kho ibra have do gyan leite khote ko buda keno to de ha ka de koina dum emergency gi 911 di dum ko grani ko aduga patient se koi gi sordi hon ba ko 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 badadi phasana response of the sordi hon ba ko adu oiraga di mi hun nung loi leire ko le ha ga si koina koi recovery position ana le patient se koi gi lateral da koi gi uppaga ko khong makha thang khong sina sanga thamaga opposite ki khong sina mathak nom ta cancel lak pai tare ko adu khutna rest torga koina maya magi mouth opening se yenga cancel ko gi hangdoga source gi lambi se phajana chatpa chatta me yengom da ka oi sometimes koina gyan mangwa patient da ko gi lei sina konchal laga ko gi airways obstruct to yawe ko adu do open up to ba mai du khadang se thangat laga ko gi soron gi passage se phajana chatibra hai bu me yengom da ka oi patient di dum mi hundi yauri bani response to phajana tawde hai ba wa ka tanish masai so holi bane aduga aduk matam da mana khara gyan la ekhole hairagadi phare ko adagi khoi sugar wang patient ore sugar gi yengani bp wang ba khole bp do suddenly down chatlam be kai to buno ko puna haibu ma yengani ko at the same time khoi 911 di ko grabane ko adagi sidagi amuk patients na amuk keno to dana henzal lakta na hai tare ko khoi gi sor hom da su holak traba lekraba khoi gi mihun su yarok traba yarok ta ko di khoi gi dum CPR se dum nambi bani ko aduga meanwhile da dum khoi gi healthcare khoi ambulance ki hai tare ko adu higher facility hospital pukhat pi batai adu phajana proper check up torma ma thau dai
irrespective of whether elderly person do cancer
elderly
patient
oidrasu sudden weakness sudden ko di mangoda sogon ba wa ba ko adu maina gyan mangi ba khot ki ba thokla gadi maina adu hospital ki facility pukhalaga phajana proper work up to gom la ka
okay thank you so much doctor thank you so much aduna ngasigi from today's discussion there is one thing that we all need to remember madudi karino harga early detection save lives aduna cancer laina or any laina je hoina nganta na detect hoba targadi magi laing patap chathaba adagi punsi kan bada yam chawna mateng pangi habji ngasigi discussion jina yamna mayek sing na takle aduna chinda ulcer amba thokpo gera natraga koi fever je hanjan janna fatraba aduga fatigue leiraba aduga adum blood clotting kumba leiraba doctor mayam ama koi rapid fire rounds raise da mayam ama thamgi ba karam kana chingna ningai oi karam kana doctor approach tawgani haibase yam mayek singna thambire aduna early detection is everything haizabatare and for the first time mayam je akoi gi singma chingna ba like ba matamda akoi gi Manipur makta da leiba cancer gi hospital or ba Carkinos cancer hospital Porampat leiba hospital gi facilities mayamna khudong chabs logi ba yagani khoina any patient kano appointment loading batargadi phone number ani khak thamjage ahan bada 87875 23654 amung han haijar bada 87875 23654 natraga 700 575 3510 amuka han haijar bada 700 575 3510 number ani asida izra call tawiduna appointment lowi ba yagani ngasi akhoi discussion sida mapung fana sarugya bikhiba akhoi doctors ahambada Dr. Thangjam Nirpendra thank you so much Dr. Pallavi Mehta thank you so much Dr. Tingujam James thank you so much and last but not least Dr. Konjam Gina Devi, thank you so much for all the insightful discussion and the enlightenment that you have brought to our viewers. Thank you so much once again. Nasigidi Carquinos Cancer Care Hospital gi Dr. Singa smaina wari watai sanaduna cancer gi matang duga lying pathap ki matang duga facility gi matang da khanajabasi matang shoi lusinjaragi. Thank you.
From its inception, Carquinos was conceived to try to tackle a really big problem at the scale of all of India, trying to find cancers in populations that historically have not been screened for cancer using conventional methods, but really jumping over those historical approaches and applying new technologies, digital tools to allow patients to be risk assessed and undergo screening with available methods, as well as blood-based early detection methods currently still under research, navigating those patients to care environments, and applying the very best molecular diagnostic technologies so that patients can pursue the very best treatment for them. It's this vision and the assembly of teams and technologies to really cover that entire broad domain that I find not only inspiring, but really unprecedented anywhere else in the globe. I think many of my colleagues who've enlisted in this effort as advisors, we do it because we see the potential impact in India and how the Carquinos model can be scaled and actually deployed in other geographies as well.